One of our burning platforms for our work in improving health systems in Ontario is the rising incidence of cancer in the province, and this is largely driven by a growing and aging population.
The incidence of cancer is rising at the rate of 2.7 to 3% per year. So over the next 10 years alone, we'll have a virtually 30% increase in the number of patients requiring radiation treatment.
If the needs just continue to go up and we do nothing, we know that providers will burn out.
Around the turn of the century and into 2001, there was a grassroots organization of radiation therapists who had taken upon themselves to investigate advanced practice in radiation therapy. We approached the Ministry of Health with a proposal asking if they would fund us to conduct a feasibility study for whether advanced practice in radiation therapy could prove to be a non-traditional and creative solution to some of the problems that we had been cyclically experiencing here in Ontario.
We need to have a different model of how we deliver care. And one of the aspects of that is the clinical specialist radiation therapist, which can add another layer in between the radiation therapist and the radiation oncologist.
The Clinical Specialist Radiation Therapist Project is one of the new roles that was put forward as part of Health Force Ontario, which is Ontario's strategy to ensure that the population has access to the kind of care it needs, the type of people it needs, and the place that it needs them when they need them.
The CSRT brings advanced knowledge, skills, and judgment to the existing interprofessional radiation medicine team. And although CSRT positions differ from center to center, all focus on increasing capacity within the system, improving the quality of care delivered to patients, and in accelerating innovation in their area of specialization.
By taking some of the responsibilities away from the doctors and even working in collaboration with them, it smoothed out some of the wrinkles in the process that were there before.
I think this is quite analogous to what has happened in nursing in the development of an advanced practice role, which has really improved the quality of care in nursing, and I expect the same to happen in radiation therapy.
In the last few months, where we've had our advanced practice therapist, it's been quite a revolution.
There are very many benefits to the program, and as a department manager, it's very exciting to see some of these new projects come.
I would say my biggest success has been implementing change and consistency within the department. I have a very good working relationship with therapists, with radiation oncologists, so I was able to easily demonstrate what could be done and what positive results could happen.
I'm contributing as a CSRT to delineate some of the target for radiotherapy and also help streamline the process.
Of paramount importance to the Ministry of Health across all of the CSRT projects was trying to ascertain if advanced practice in radiation therapy could decrease wait times for the patients in Ontario.
The radiation oncologist can see an increased number of patients by focusing on the tasks that only a radiation oncologist can do, and these other tasks can be taken on by a clinical specialist radiation therapist. All of our data shows that patients are happier when these tasks are done, because they're done in a more standardized fashion, which helps the patients get through their treatment more quickly.
When you think about it, what's the most important thing is to have the care that the patient needs immediately. So having advanced practice therapists being able to educate patients, talk to patients, talk about their toxicities at the time when they need it has been really helpful to the patients.
Healthcare as we know it will transform with changes in healthcare funding in the very foreseeable future. And so this is leverage for achieving that change.
I could see this position growing quite significantly, either improving the current provision of care or just basically growing our ability to provide more care with fewer resources.
We're actually using the original competency profile developed by the CSRT project, and we've rolled that out nationally, we've validated it. So it is quite exciting to think that we're using that as a national framework, and hopefully in a few years different provinces and different jurisdictions will be using that to develop their own CSRT roles.
We should do a lot more of this. and rely on the folks trained in radiation medicine who get it, and rely a lot less on other allied professionals.
If we work in new and innovative ways, together in collaborative teams in delivering care, we'll not only be better able to meet the future needs of patients as a whole, but individual patient care will improve.
Because we're all focused on delivering quality care to patients.